Hello, this is Dr. Tom Groover of Boulder Chiropractic Clinic and Extension Division of Palmer College of Chiropractic. We're an Extension Division now because I'm on the Extension faculty there at the college, and I have with me my first intern, Darsej Ray. Welcome, Darsej.
Thank you. Thank you. Good to be here.
Yeah, and we've had some very deep philosophical conversations because one of the things that you'll find out about chiropractic students is that they're very, very interested in the philosophy of chiropractic. So I'd like to spend a little time today going over some of the fundamentals of chiropractic philosophy. So one of the things that we start out with as fundamental to that philosophy is that there is an order to the universe. And that order is a result of a principle in nature called creative intelligence. And creative intelligence manifests in the human physiology, and according to chiropractic, which is a vitalistic philosophy and practice, that your level of wellness or disease is a function of how much creative intelligence is operating within your physiology. So the early founders of chiropractic discovered this principle and began to treat disease using a different model, and that was that if you bring this creative intelligence, this fundamental life to the person, that you will manifest health. And this was in opposition to allopathic medicine at the time, which was if there's something that's not functioning normally in the physiology, in other words, it's something is overacting or there's an imbalance, what you do is you poison the body in order to be able to shut that off. So that's a way of treating disease through basically turning off the physiology or some aspect of the physiology, where chiropractic is about turning on all the valuable aspects of the physiology so the body can heal itself. So there's a fundamental of self-healing, wouldn't you say?
Absolutely.
Yeah.
Based. It's a great base, yes.
Yeah, that's the fundamental. And tell me some other things that impressed you about the chiropractic philosophy.
Well, I like that the chiropractic philosophy branches out. It just doesn't talk about sections of the body. It talks about your body as a whole, and even beyond your body as a whole, what's making that body run, and where is that information, energy coming from? And then focusing primarily on the nerves and the brain, it makes a lot of sense that everything is traveling in our body back and forth that way. But it does touch on much more of what's getting our information even to our brain and to our nerves and into our senses and further on. There's a strong body-mind connection that's involved with chiropractic, and as Dr. Tom said, there is a strong vitalistic approach. And I'd like Dr. Tom to actually define what vitalism means.
Well, vitalism, I mean, by definition, vitality is the liveliness, okay? So one of the qualities of creative intelligence is that it's lively. You know, it's lively, it's life-giving in and of itself. It is life. So when you notice someone that has vitality, you notice that they're intelligent and they're creative, they're energetic. And also you'll notice a lot of times that some people will have like a sort of an illumination quality about them, like an aura. You look at someone's face and it's very crisp and bright. And their speech coming out of their mouth is very crisp and bright, and they have a sparkle, all right? So now that's a person that has that vital force that's operating very fully. And when that's present, our experience is that that's a sign that a person is in good health. So it's one of the ways that we diagnose in chiropractic is that we visually inspect a person And that means we look at their posture and we look at, how they walk and other factors, but we're also looking to see how bright they are, how much light they have shining through them, and you know, that's one of the ways that we look.
So how vital they are.
How vital
that
they
glow
are.
is how vital they are. And so when we're here in Boulder, Colorado, a lot of people talk about consciousness. They name coffee after consciousness. You know, it's kind of a word thrown around here and there. And to what you just described to me about vitalism, I would almost could be confused. What's vitalism and what is consciousness? Because when I see somebody glowing, I would say, well, that person might be more conscious of themselves, or I may even say aware, you know, and then there's this word awareness and consciousness and vitalism. How would you split those up if they can be split up?
Well, consciousness itself consciousness is basically formless. There's no shape, there's no form, there's no energy in consciousness. It's unmanifest. And so in terms of life, it would be as if life is a movie and it's projected on a screen, and that the screen, the vividness of the life, the color, the shape, the attractiveness of life is largely dependent upon the clarity and the cleanness of the screen. So if you've got a dim screen, you're not going to have a very delightful movie. But if your screen is clean and bright, then everything shines out with a nice, crisp, clear, enjoyable image. So consciousness is like that underlying, unmanifest field, you know, and it has, we call it, in the research that I was doing years ago in Europe, was called the field of all possibilities. Because within consciousness, within this unmanifest field, there is intelligence and creativity, the potential state of intelligence and creativity, and for the manifestation of basically everything, our thoughts, our feelings, our physical bodies. So the idea is that if we have access to that field, that when we act from there, when we think from there, when we perceive and feel from that field, that we are more attuned with it. And by being more attuned with it, what we would say is that person has more consciousness, so to speak. Well, what that means is they have more access to the field of consciousness in their daily activity. All right. So, and when you have that, the expression is one of vitality that you see in the person. So the more consciousness you have, the more potential for health, because consciousness contains that creative intelligence, that expression of life that organizes and arranges everything according to natural law. So another assumption of chiropractic philosophy is then that the body is really set up for success. And we did an interview last month or so with a lady, Miwa Mack, and her topic was that the human system is set up for success, and anything which is not successful is you know, not you. It's not your energy. You know, it's foreign. And so if we really are aware of really who we are, which is infinite, pure, creative intelligence, you know, if we have that awareness, we're aware of our higher self. It's not a selfish thing in terms of the small s self. It's not self-absorption and narcissism and all the things that you observe with people who are full of themselves. It's the awareness of, you know, that we are life, that we are connected with everything that we see, smell, taste, touch, think, feel. It's all us. It's all coming from the same place, and we are all coming from the same place, and in fact who we really are is that place inside. So the exciting thing about chiropractic for me, coming from this vitalistic philosophy background and understanding of the what I would call the science of creative intelligence. That's something that's used by the transcendental meditation people from which I come. You know, Maharishi Mahesh Yogi was very clear about all the distinctions of creative intelligence, and he named his learning system the science of creative intelligence. So that's my background, you know, and you know, I have a bachelor's degree, a bachelor in the science of creative intelligence. Yeah, from Maharishi European Research University out of Seelisberg, Switzerland. So we spent a lot of time on this, and transitioning from being a teacher of transcendental meditation to chiropractic was quite natural for me. I really wanted to do chiropractic with a passion because of learning about the chiropractic philosophy. But the idea is that the body has the potential for success, and what chiropractic does is it removes the impediments for success, particularly by clearing out the injuries and abnormalities in the joint function, initially starting with the spine and expanding out to the extremity joints. So you have your many little spinal joints down your spine and into your pelvis. And then you have shoulders, elbows, knees, ankles, wrists, you know, feet, rib cage, temporomandibular joint. And what we find is that through wear and tear on the body, through normal living even, without having to be in a car wreck or without having to be a football player, that people have little slips and falls throughout their lives, and they bonk themselves and get bonked, and it misaligns the joints in their bodies. And because of that connection between the mind and body, as you said, that communication that's always going on, we call that a whole feedback system. The human is a feedback network, is composed of an intricate, elaborate system of feedback. You think of a simple feedback as something like the relationship between your adrenal glands and your pituitary gland, which then governs how the thyroid gland functions, which then feeds back into governing to some extent how your adrenal glands function, you know. So that's a feedback. And we have that feedback everywhere. In fact, we have it in every joint of the body. And when a joint is twisted or yanked or pushed out of its proper position, where the bones are positioned, you know, very specifically to relate to each other. And that positioning creates a harmony. Their body is harmonious with that joint as long as that position is maintained. But if there's a trauma to the joint and it gets pushed out of place, then there's a huge neurological feedback that happens, a loop that happens where that misalignment is perceived by sensors in the joint capsule and the muscles and the tendons and the ligaments that feed that into the system and contact the brain. The brain becomes aware of that injury, and it's like your computer. It's like there's an error message that's registered on the screen, you know, and that doesn't go away until that injury is resolved. Well, if you have 10 different joint misalignments, that's a lot of error messages, and it's really hard to wade through all those error messages and sort out, you know, and be able to make proper calculations to actually be able to use your computer effectively when all of these errors are taking place simultaneously. You'll max out your processing unit and everything will crash. So people will crash eventually when they're loaded up with these misalignments, or in chiropractic it's called a subluxation, a misalignment of a joint less than a dislocation. And so with a buildup of these things, what happens is the person's threshold for adaptability is exceeded. So you can't restore the physiology back to its normal biochemical and mechanical and neurological functioning. And so you're out of that range all the time. And that puts a person's immune system at risk, so that you can get disease, you can get infected. It puts your thinking in a position where it's less clear, you're less alert, you're less, sharp in your thought. You can't really gather accurate information about your environment because everything is all cluttered up. So at that point, you're set up for having problems in your life. Now, if we clear out all that so that there's no negative feedback coming into the brain, and so then the mind being the ultimate expression of our entire physiology, then can function better. So we'll have clearer thinking, we'll feel better, we'll be happier, healthier, and more successful. So that's a fundamental paradigm that we use here in our clinic. Yeah.
Would you talk about the joints, any joint, anywhere in our body, from our toe to our fingers, all the way up to this joint here where my skull sits on top of my first vertebrae. Now you have been focusing on just this misalignment amongst all the other joints, but what makes this one more special to you when you talk about all the joints that can misalign, and our connection to vitality or our connection to consciousness? What makes this a little bit different than everything else?
Well, B.J. Falmer, who was the developer of chiropractic education starting back in the late 1800s, discovered the upper cervical spine as the sort of the major neurological control center for the nervous system, in the sense that your brain is up here in the cranium, and then there's a hole at the base of the cranium called the foramen magnum. And so the brain comes down, forms a spinal cord down through that canal that passes from that foramen magnum down the back of your spine through the arches of the spine. All right? So that's called the neural canal. And when the upper cervical spine, the base of the head and the first two vertebrae in the neck, when they are subluxated, when they're misaligned, there are problems, there are abnormal forces exerted upon the brain stem and the brain and the nerves, the spinal nerve roots, and there's connective tissue that's very much attached up in this area that protrudes up into the cranium and down and surrounds the spinal cord. There's so much influence there that the information, the sort of messages, the neurological messages going up and down through that area become impeded to some extent or another. If there's a large amount of impedance, a person will, their health will be really at risk. And if there's a small amount of impedance, they just won't be as expressive in their lives. I know that one of the things that happens when that misalignment of the upper neck part of the spine, when that happens, the posture distorts quite severely. If it's a big misalignment, then the pelvis will tilt really far, and the body will shift off of the center of gravity, and there will be hugely more weight on one side than the other when you're standing. And there'll be what we call a physiological short leg, where one leg will be pulled up shorter than the other because of that postural distortion. And so just from a very simple sort of Newtonian physics point of view, at that point there's a lot of mechanical stress on the body because of all this tilting and shifting that's going on. Because the body ideally is intended to be centered, and everything is supposed to balance on a central axis. When it shifts off that axis, then there's tremendous effort to keep the body upright, and there's also significant stress on your spinal joints and your extremity joints, because being off that center, then there's a gravitational jamming that goes on, so to speak, where the whole system kind of gets squished down and joints will compress, and there'll be significant wear and tear.
So it almost sounds like a correct posture is going to be more energy efficient?
Yes.
Yes.
Yeah.
So part of being in alignment is just getting back enough of my own energy, or not spending energy on other misalignments within my body or incorrect posture, and put that energy towards healing? Or where does that extra amount of energy go? If I become energy sufficient,
if you gather up all your resources, well, the first thing what we find is it'll go toward healing. So typically there's tissue damage that occurs, and I'm talking about ligaments and tendons and muscles, but I'm also speaking about nerves. So there'll be quite a bit of damage to a joint that needs to repair. And also, the muscles, from a very simple muscular point of view, when a joint misaligns, the muscles are out of control. The muscles that run that joint will go out of control. So you'll get, tightness and spasm and, contraction, very restricted motion in a joint sometimes when the joint's been misaligned for quite some time. So we realign the joint, and then what will happen is those muscles will have to normalize. Their length and tension relationships around the joint will have to become normal for that joint to function normally. So a lot of energy will go toward that, but then there will be plenty of energy left over for, operating and strengthening and operating the immune system, your digestive system, managing your blood sugar, managing your heart, your blood pressure, all of these things that we've observed here in the clinic. We won't do nutrition workups here until a person's subluxations have been cleared, because otherwise we're just treating, very superficially, because the digestive system is impaired as long as you have subluxations in your body.
So how long does this process take? Is this something we can do in a month?
Yeah, you could do it. You could do a lot of this work in a month or two, But what we want to make clear is that the longer a person's been injured, in the injured state, meaning you could have an injury when you're 3 and now you're 50. And that injury, the injured state can remain that whole time. It's just that you recover from the initial tissue damage and you adapt to the trauma. So everything seems to be normal, but you've got some whopping neck problems that you don't know about until it starts showing up as, pain, arthritic changes. Maybe those show up like when you're 40. And so what we're talking about is a model that's preventative and curative. It prevents pain from creeping into your life when you get older, but it also will help resolve joint problems as early as possible once you catch them, and allow those things to reverse, allow the narrowing of the vertebral discs and the development of bone spurring and things like that in the joints in the body to allow things to improve. Now, a lot of times with bone spurring, you don't clear those out, but you can restore the ligaments. They can heal the tendons, the muscles, and the nerves, and reduce the inflammation down so it doesn't hurt anymore, and improve a person's quality of life for an indefinite period of time. But follow-up is necessary. A series of evaluations, being able to correctly diagnose each joint misalignment and apply the appropriate treatment to realign those joints and the rehab needed to straighten out any other neurological, muscular type problems, soft tissue problems, and to stabilize this work. So there has to be a certain follow-up. It's not like a quick one-time fix that happens. A person, a lot of times they've spent an entire lifetime putting themselves into this broken down state. So it's probably going to take the rest of their life to maintain their excellent health. But the idea is to raise a person's level of vitality and their creative intelligence up to a very high level so that they can't easily fall back into a symptomatic, broken down state.
So it's the vitality along with the pain going away that would keep one or make one understand that this is why I need to keep coming in. Even though my symptoms have gone away months ago, I still keep coming in to get checked because I know it's good for me, because I feel brighter, I feel more vital, right? And then it's that feeling, that energy sufficiency within me, that's what makes me want to keep up with care.
Right. We always know that eventually if things run down, you'll be back because you'll start hurting. But it's a question of whether you want to get to that place or not. And it's really the patient's choice. So, do you want to maintain your functionality, which puts you in a position where you can way prevent, getting into a broken down pain state. So let me give you an example. All right. Let's say a person's number 3 lumbar vertebra misaligns. Subluxation happens there. And what we know is that when that happens, the L3, the third lumbar vertebra nerve root, becomes impaired. And so their thigh flexor becomes weak. And so when we test a person here, during our checkups, we always check. If we've previously found problems with the low back, we always check their low back. And the way we check it is by checking these nerve roots and see if there's, muscles associated with those nerve roots are strong. Well, the first thing that will show up early on is the weakening of the muscle. So the question is, do you want to catch it when the muscle's weak and fix it? Or do you want to wait until it starts hurting and then fix it? And there's a progression. First the muscle will weaken, and then inflammation will set in, and then pain. And if you leave it long enough, then the disc will be injured. And then you won't be able to walk or sleep or stand, And so, how far do you want to let it go? Depends on how severely that lumbar spine has been injured. But even with people who've had, pretty bad disc injuries, they come in, we line up the joints of the lumbar spine so that the neurology can work properly, so that the area can heal. And then the disc itself can heal. And the patient can be better. But I always warn patients that once you injure a disc, it's weak for life. It'll heal up to a certain point, but you'll have a vulnerability. And if you go back to doing the things again that injured the disc and re-injure it, then each time you re-injure it, it gets worse, even after we've healed the disc. And so you put yourself in a downward cycle where eventually we won't be able to help you anymore. Your surgeon will. So, that's just a little bit of, I'm not trying to scare everybody about this, but that's just the reality of what goes on. So taking care of yourself through chiropractic is preventative in many ways. It can prevent you from having to go to the surgeon and go under the knife. It can prevent you from having to take pain medication and anti-inflammatory and all of that kind of stuff. And prevent you from having to have your nerves burned, which some people do. You can maintain your nervous system and the integrity of your body if you prevent these things from happening. But even before it gets to that serious state, you can also increase your vitality, your creative intelligence, by removing the problem at its source and healing it so that it remains stable, so that you don't get further subluxations in the area. But you always have to watch out for what you do, because there are things that people do quite ordinarily, things that they do like bending over and lifting, or bending over and twisting and lifting, where the low back is flexed. It puts it in a really vulnerable state. And if you do that enough, like spend a whole day bending over, yanking weeds and moving rocks, you're going to come up with some low back issues. And if you do that, come right in and we'll fix them. But I mean, if you keep doing it over and over again without the proper use of your body, you can still pull weeds, you just have to do that the right way. You can still lift rocks, but people do it in the wrong way. And that's where we get into trouble. And then they have that experience where they bend over in the shower to pick up a bar of soap and they fall to the floor in terrible pain and they can't get up, and they crawl to the phone and they dial 911 or they call me. Well, thank you, Darsej. I appreciate your being here to pull all this out of me, and we should do another interview when you become a new doctor.
That would be interesting.
When you graduate, and you're going to graduate in about 3 months, 2.5 months, and be out in practice. And you know, if we're lucky here at the clinic, we'll have you here. However you go, we wish you the best of luck.
Well, thank you. Thank you. Well, thank you for adding in the vitality, adding in the consciousness to this, because a lot of times I didn't know that was involved with chiropractic when I first came into it, and a lot of people continue to not involve it in chiropractic, which surprises me. But I'm grateful for people like you who stay in touch and know yourself well and know your patients well and want the best for them, vitalistically, consciously, energetically.
Thank you, and thank you all for watching.